Hi, my name is Marisa Watkins, and the career I'm planning to pursue is labor and delivery nursing. Labor and delivery nursing is a type of nursing that assists the mother with all parts of the birthing process, including antepartum, delivery, and postpartum care. These nurses ensure the safety of the child and the mother throughout the process, and administer the necessary treatments to do so. Some things that labor and delivery nurses do are tracking the vitals of the mother and baby, tracking the status of the mother during labor via contractions and her dilations, as well as administering epidurals or preparing her for a C-section. They also serve as a big support psychologically for the mother, guiding them through labor with encouraging and leading phrases to ensure the smoothest process possible. The working conditions for labor and delivery nurses is most commonly in a hospital, working with an interdisciplinary team of nurses, doctors, and other medical professionals. Typically, labor and delivery nurses occupy triage, operating, labor, and antepartum and postpartum rooms in the hospital, as well as the infant nursery and neonatal intensive care unit, or NICU. Co-workers would be any medical professionals working in the hospital, which could be different types of registered nurses, such as NICU nurses, and the team of labor and delivery nurses together would be considered another specialized team. Supervisors for labor and delivery nurses would be the doctors or team of doctors they are working with in the hospital. To become a labor and delivery nurse, the minimum requirement is an associate's degree in nursing. However, having a bachelor's degree in nursing is becoming more standard and competitive. After that, getting state licensed is required, which means with the degree is also graduation from an approved nursing program, as well as passing the National Council Licensure Examination for Registered Nurses, or the NCLEX exam. From there, it's typically required to work as a registered nurse, RN, for at least 1 year before specializing in labor and delivery. To specialize, continuing education is required, meaning getting certified in things like advanced cardiac life support, ACLS, electronic fetal monitoring, CEFM, and a neonatal resuscitation program, the NRP. Minimum certifications to specialize are required, but additional certifications can be obtained by nurses so that they can get ahead and broaden their scope of ability. An example of this is earning their inpatient antepartum nursing certification, the RNC IAP, to be able to work with the mother before birth. The International College of Nursing and Midwifery published a study done by the College of Nursing at the University of Suleimani, Iraq, where they interviewed a sample of postpartum women, aiming to study the relationships between the quality of nursing and patient care during their intra and postpartum periods and the mother's maternal satisfaction. The findings of this study were considered statistically significant in that women were strongly satisfied with their experiences of the childbirth process. They concluded that caregiver and client interaction, as well as nurses' perception and involvement with the client, were the main factors contributing to their satisfaction and outcome of the labor. This study shows how labor and delivery nurses have the ability to ensure mother satisfaction during childbirth, a very unknowing and vulnerable experience. Being that strong support and guidance throughout the process can create a positive and encouraging environment necessary for mother satisfaction throughout childbirth. My stepmom is a labor and delivery nurse and is who inspired me to pursue this career. I asked her a few questions about it regarding her biggest takeaways and what she could tell me before I began the process. She enforced a mantra that parallels with the study I previously discussed, in which she said, quote, "Something to be mindful of is the responsibility you are taking when being the operator in the most important moment of some women's lives. Doing your job to ensure the health of both the baby and the mother, whilst being an emotional support, is a large role, but can be so rewarding and impactful on so many lives." End quote. My career path begins now, studying nursing as an undergraduate student. My next step will be this summer getting my certified nursing assistant CNA certification and working as one throughout undergraduate school. Then, this time next year, the winter of 2023, I will apply to the University of South Florida's Upper Division Nursing Program and begin that process for the remaining 2 years of undergraduate school. As a nursing major as an upperclassman, I will begin studying for the NCLEX exam, which I can take 45 days after graduation. I will graduate with my bachelor's in nursing and completion of University of South Florida's nursing program. After getting licensed, I will begin my job search. Thank you.